At introduction, hello and welcome. Today we're focusing on a complex and often challenging cancer, bile duct cancer, also known as cholangiocarcinoma. This cancer arises from the cells lining the bile ducts, the tubes that carry bile from the liver to the gallbladder and small intestine. Understanding this disease is crucial for early detection and improved outcomes. We'll explore its causes, how it develops, its symptoms, diagnosis, and treatment options. Etiology, causes. While the exact cause of bile duct cancer isn't always clear, several risk factors have been identified. These include primary sclerosing cholangitis, a chronic inflammatory disease of the bile ducts, liver fluke infections common in Southeast Asia, bile duct cysts, and exposure to certain chemicals. Conditions like ulcerative colitis, cirrhosis, and diabetes have also been linked to an increased risk. However, it's important to remember that many people with these risk factors never develop cholangiocarcinoma, and some people with the disease have no known risk factors at all. A pathophysiology, cholangiocarcinoma develops when the cells lining the bile ducts undergo genetic mutations, leading to uncontrolled growth and proliferation. These abnormal cells can form a tumor within the bile duct, obstructing the flow of bile. This obstruction leads to a buildup of bilirubin, a waste product in the blood, resulting in jaundice. The tumor can also invade surrounding tissues and organs, and spread to distant sites in the body, a process called metastasis. The specific location of the tumor within the bile duct system influences the type of symptoms and the challenges of treatment. Epidemiology, bile duct cancer is a relatively rare cancer, accounting for a small percentage of all cancer diagnoses. Its incidence varies geographically, with higher rates observed in regions where liver fluke infections are prevalent. The disease typically affects individuals over the age of 50, and the incidence appears to be increasing in some parts of the world. Understanding the epidemiology of cholangiocarcinoma helps researchers identify potential risk factors and develop targeted prevention strategies. Signs and symptoms. The symptoms of bile duct cancer can be subtle and often don't appear until the cancer is advanced. Jaundice, characterized by yellowing of the skin and eyes, is a common symptom. Other signs include abdominal pain, dark urine, pale stools, itching, weight loss, and fatigue. Because these symptoms can also be caused by other conditions, it's important to consult a doctor for a thorough evaluation if you experience any of them. A diagnosis. Diagnosing bile duct cancer can be challenging. Doctors use a combination of imaging techniques such as CT scans, MRI scans, and ultrasound to visualize the bile ducts and identify any abnormalities. A cholangiogram, where dye is injected into the bile ducts to make them visible on X-rays, can also be performed. Biopsy, where a sample of tissue is taken for examination under a microscope, is crucial for confirming the diagnosis and determining the type and grade of the cancer. Blood tests to measure liver function and tumor markers can also provide valuable information. Classifications. Types. Bile duct cancer is classified based on its location within the biliary system. Intrahepatic cholangiocarcinoma occurs within the liver. Perilar cholangiocarcinoma, also known as Klatskin tumor, develops at the junction where the left and right hepatic ducts join to form the common hepatic duct. Distal cholangiocarcinoma arises in the lower part of the common bile duct, near the pancreas. The classification is important because it influences the treatment approach and prognosis. A treatment and management. Treatment for bile duct cancer depends on the stage and location of the tumor, as well as the patient's overall health. Surgery, aiming to remove the tumor completely, is the primary treatment option when possible. However, surgery may not be feasible if the cancer has spread or is located in a difficult-to-access area. Chemotherapy and radiation therapy may be used to shrink the tumor before surgery, or to kill any remaining cancer cells after surgery. In some cases, palliative care, focusing on relieving symptoms and improving quality of life, is the main focus of treatment. Targeted therapies and immunotherapies are also being explored as potential treatment options. Prevention. While there's no guaranteed way to prevent bile duct cancer, several steps can be taken to reduce the risk. These include getting vaccinated against hepatitis B, avoiding exposure to known risk factors such as certain chemicals, and treating underlying conditions like primary sclerosing cholangitis. In regions where liver fluke infections are common, proper sanitation and food preparation practices are essential. Regular check-ups with a DULP detect any abnormalities early on. A prognosis. Recent research or advances. The prognosis for bile duct cancer varies depending on the stage of the disease at diagnosis, the location of the tumor, and the patient's overall health. Early detection and surgical removal offer the best chance of long-term survival. However, even with treatment, bile duct cancer can be aggressive and challenging to manage. Ongoing research is focused on developing new and more effective treatments, including targeted therapies, immunotherapies, and novel surgical techniques. Scientists are also working to identify biomarkers that can help detect the disease earlier and predict treatment response. The future of cholangiocarcinoma treatment lies in personalized medicine, tailoring treatment to the individual characteristics of the tumor and the patient.